Hi, everybody. This is Lee, and I'm talking about Physicians for National Health Program. They have a website. It's PNHP.org. And so this is a group, it's a single issue organization, and that they are advocating a universal, comprehensive, single payer national health program. That's their purpose and their mission, and that they have more than 20,000 members and chapters across the United States dedicated to this single issue of single payer healthcare. And that they've been doing that since 1987. And so they do research, they coordinate speakers, they participate in town halls and debates, they contribute scholarly articles and peer-reviewed journals on this issue. And so they are claim that they are the only national physician organization in the United States dedicated exclusively to implementing a single payer national health program. Okay, and so they have their mission statement as well. Again, advocating for national comprehensive single payer national health insurance. They believe that healthcare is a right, high quality healthcare, and so that they aim to educate physicians, other health workers, and the general public on this issue, and that they believe in equitable accessibility to healthcare, and that this is a campaign as part of the social justice in the United States, that they oppose for-profit control, especially corporate control, of the health system. They favor democratic control, public administration, single payer financing. And so this is what they consider a social justice issue with economic justice ramifications, intersection. Okay, and so they believe that they say that this program should be financed by truly progressive taxation, that they oppose current changes in the healthcare system that are designed to maximize the profits of investors and the incomes of high level executives rather than to serve patients. And that they wish to restore the primary mission of physicians who are supposed to be acting as professional advocates for patients. And that they are independent, nonpartisan, voluntary organization. They are supported by members' dues and grants by progressive foundations. They have no funding from pharmaceutical companies or other for-profit institutions. That they organize physicians, medical students, and other health workers and the public in support of a national healthcare program. And they want to promote discussion of health policy in the United States through conferences, lectures, articles, and other methods. Okay, and so there's also, I'm going to link that information in the description so you can learn more about the advocacy of the Physicians for a National Healthcare Program, their intentions, what they're trying to do. And then I'm also going to link to an article, leading British medical journal spotlights inequality in health in the United States. It's a new study in the Lancet. They examine the effects of racial segregation, mass incarceration, economic inequality, and then a lack of universal health care as factors in declining U.S. health outcomes. And they point to a growing survival gap between rich and poor. So again, for those who are trying to separate out issues, saying it's racial, it's economic, apparently there's been studies done from outside looking in, concluding that, again, that they're all intertwined, and most people are realizing that these issues, health outcomes, healthcare, lack thereof, mass incarceration, racial segregation, economic inequality, that they're all intertwined. They're not separate issues. Okay, and so I'm also going to link to one of the latest press releases by Physicians for a National Health Program. that they have commented on the activity that occurred recently in the House to pass the American Health Care Act, which is now going to go to the Senate for consideration. That doctors group House leaders are out of touch with the majority of Americans demanding Medicare for all. And so this is Carol Paris. She's the medical doctor. She's president of this organization of Physicians for a National Healthcare Program. She says that the vote shows that the House leaders are not only out of ideas on healthcare, but out of touch with their own constituents. In polls and at town hall meetings, Americans consistently demand Medicare for all, the only plan that is universal, sustainable, and proven to work in every other industrialized nation. And so the person who's in charge of this organization, the physicians group, she's urging members of both parties to support H.R. 676, the Expanded and Improved Medicare for All Act. This is John Conyers' bill. I've spoken of many times on this channel. And so that this group is supporting that. They've endorsed it. They believe it. They champion it. They're educating on it. They feel that this bill would provide immediate comprehensive coverage to all Americans and achieve President Trump's campaign promises of more coverage, better benefits, and lower costs. And that currently there's 108 co-sponsors in the House of this bill, and that 24 have signed on in the past month. So, again, John Conyers' bill is being supported by 21,000 physicians. It's being supported on the ground at the grassroots. It's being supported inside the United States Congress. And so I'm going to post this advocacy, the links in the description so people can learn more about Medicare for All, John Conyers' bill, and read what the bill entails and what it's about. And then also the activities surrounding it, the research that's been done on it, things like that, and even discussion of the economic aspects of it. So again, I'll post that link in the description. People can learn more. Good luck.